Hello and welcome to this segment on endoscopic discectomy with the DiscFX system. I'm Dr. Matt Wiederholz, co-founder of Performance Spine and Sports Medicine. Today I'm going to be talking about the anatomy of the intervertebral disc herniations, discogenic pain and discography, the DiscFX system, and why endoscopic discectomy. So first, let's talk about the intervertebral disc. The anatomy of the intervertebral disc consists of two main parts, the outside and the inside. The annulus fibrosus is the outside, and the nucleus pulposus is the inside. I talk to my patients about thinking about the intervertebral disc as a jelly donut. The annulus fibrosus is the outside of the donut, and the nucleus pulposus is the jelly of the donut. Here's a picture with the tough outer fibers of the annulus fibrosus and then the nuclear material on the inside. The annulus is made up of very tough fibers, and there are multiple layers of annular fibers, and that holds that jelly inside the disc. The nucleus is the shock absorbing feature of the disc and provides that relief from axial loading. Degenerative disc disease is when that nucleus, the jelly, loses its water content, starts to shrivel up a bit, and that's degeneration of the disc. That's similar to the skin developing wrinkles. We lose water content in our young skin and we start to get wrinkles. So degenerative disc disease in and of itself is not necessarily abnormal. However, disc herniations are abnormal. That's when there's a weakening of the degenerated annular fibers, and the annulus develops small tears called annular tears, and that can result in nuclear material, or the jelly, leaking out or herniating out of the disc. This causes severe inflammation and pain, and patients will complain of sciatica, which is pain shooting down the leg with disc herniations. There's a grading system to those disc herniations. You may have had an MRI done at some point, and you tell your doctor, hey, I have a disc bulge. Disc bulge is the most mild form of disc herniations, and then they go up in severity from protrusion to extrusion to sequestration. So a disc bulge is just a general bulging of the disc. A protrusion is when the annular fibers are actually protruding out because that nuclear material is pushing against it so strongly. And extrusion is when the outer fibers are torn and that jelly is leaking out. And a sequestration is when the jelly actually breaks off and is just floating in the epidural space. So discogenic pain and discography. Discogenic pain usually results in either back pain or leg pain, or possibly both. Back pain is usually in the center of the spine, and then sciatica might be present. Discography is a diagnostic test performed here at Performance Spine and Sports Medicine to prove whether one is suffering from discogenic pain. There are many causes for lower back pain, which you can review in some of the other videos, but discogenic pain is one of those types of pain. This involves placing a needle inside the disc and then injecting contrast material to pressurize the disc. We use a pressure gauge to see how much pressure we're filling the disc with, and then we determine whether that's causing someone's pain. Those pressure readings and pain levels are recorded, and then a CAT scan is done to take a look at the architecture of the disc, and the tears that are noted on the CAT scan are also documented. Here's a picture of a discogram. As you can see, there's contrast material filling the disc here. You'll see the bone here, another bone here, and in between is a disc. Here's the needle and injecting contrast material. Same thing at this level and same thing at this level. The DiscFX system is a minimally invasive procedure that's used to decompress disc herniations. It treats the pain from annular tears as well. It can help treat back pain and leg pain, unlike other minimally invasive procedures that may only work for leg pain. It's indicated for contained herniations, so we talked about those grading scales. So if you have a disc bulge or a disc protrusion, you may be a candidate for the DiscFX system. If you have a disc extrusion, jelly leaking out, you probably are not a candidate for this type of procedure. The recovery is extremely fast, and it may allow a patient to avoid a major operation. These are the tools that we use during a DiscFX case. We've got the radiofrequency probe, also known as the trigger flex probe, and that provides a heating element or a heat treatment to the outer fibers of the disc as well as the inside of the disc to shrink that disc if it's a disc bulge. We have some introducers here that allow us to put the scope or the camera through, as well as some tools such as this, which is a grasping forceps, which allows us to just remove some of the disc material to decompress those herniations. So why DiscFX? Again, minimally invasive. Recovery is fast. You're back to work very, very quickly. And you may be able to avoid major surgery. Disc bulges and protrusions that are causing pain, documented by discography, do not need major surgery. So let's conclude. Disc herniations are very, very common. Disc herniations cause back and or leg pain. Disc herniations are treatable. Not all patients need major surgery to treat those disc herniations depending on the grade or the severity of the disc herniation. Most patients are candidates for minimally invasive techniques or procedures. Minimally invasive techniques lead to faster recovery and increased productivity. Thanks for your attention. You can get more information on our website at njspineandsports.com. Feel free to give us a call or schedule an appointment with me or one of my partners at your convenience.